Hello, now that we have finished our introduction to the overall purpose and structure of the clinical instruction program as part of the Stanford Faculty Development Program, we're going to begin to go through each of the 7 categories, 7 modules in the Stanford program. The first of these is learning climate. I have modified the materials from the materials of the Stanford Faculty Development Center. Remember, we have 7 categories in our educational framework, and the first of these is learning climate, and that's what we're going to be doing now. To review just for a second the major activities of each module here on the right, there'll be a short mini lecture in which I'll help you learn the educational concepts, the definitions, and the key components. And then later on we'll do a video review to give you a chance to recognize these behaviors. When you're in town, we'll do role plays, goal cards, and go over the readings. Well, let's get to it. Learning climate. Definition, purpose, timing, and the components and the specific teaching behaviors. Let's begin with our basic premise, though, that teaching is a form of leadership. It's about bringing out the best in learners, creating the right setting so that there is trust in the learning environment and people can address their limitations. Definition for learning climate. Learning climate is the tone or atmosphere of the teaching setting, including whether it's stimulating and whether learners can comfortably identify and address their limitations. Now, the first thing that we want to say is that the word learning climate itself sounds somewhat nebulous, cloudy, atmospheric. The word climate sounds very vague. And part of our approach throughout these 7 sessions will be to be concrete, visual, clear in what it is that the teacher is doing so that we minimize guesswork on the part of the student. That will become apparent as we go along. We want the learning climate to be stimulating so the learners feel energized. An alternate definition for learning climate is, does the learner want to be there? Do they feel like they're learning, getting something out of this? And finally, probably the most important point, is whether learners can comfortably identify and address their limitations. The premise, of course, is that they have limitations and that there is a certain amount of discomfort for any intelligent person in confronting what they don't know. This triangle, we'll use this repeatedly through the 7 sessions, emphasizes the relationship between the teacher, the learner, and the ultimate content that we want them to master, the goals for their learning. It's a triadic relationship. Now, the first definitional point right now is that when we speak of learning climate, we mean the relationship between the teacher in the room and the learners in the room. What things the teacher does to establish a relationship with that learner that makes learning possible or enhances learning. And we're going to distinguish that from the other word that people sometimes use, learning environment, by which we will mean the big picture. What's the call schedule? Do the computers work? Is there parking? So learning climate is specifically about what the teacher does. Now I'm going to use this triangle to make a point that will run throughout all our 7 sessions, and that is, what is the point of the entire educational process? What is it that learners are learning when they master the content? And in a phrase, what we're after is the progressive independence of the learner. By the end of the 7 years of medical school and residency, longer in the case of some specialty, the learner has to be able to function independently. At the end of medical school, the graduating medical student has to be able to function with supervision, but has a lot of responsibility and in fact has a degree, a medical degree, a license to commit medicine. If we do this visually, I can express it this way. At the end of the process, of the educational process, however long it is, the faculty, the teachers, need not be physically present. To some extent, their knowledge, their sense of duty, their values are internalized in the learner, but the whole process is about helping the learner become independent. Now, why is learning climate important to this? First, learners have limitations to be addressed, especially at the beginning of the process. They don't know enough, they don't have the skills, they don't have the emotional resilience to deal with problems, they don't know how to deal emotionally with patients who are suffering. The cognitive load of learning to be a physician is enormous, and it should not be aggravated by emotional load, which is the wrong kind of stress. In other words, the relationship between the student and the learner should be supportive and should not contribute additional stress that is already inherent in the situation. We know that expectations do and should increase over time, over the 4 years of medical school and the years of residency. In other words, there's more and more responsibility as you go from a reporter to interpreter to manager of a team. Cognitive load does not decrease with time. In fact, it increases. And therefore, the stresses inherent in that are always going to be growing. And so learning climate, the supportive atmosphere is critical. Finally, the typical medical school and residency curriculum may aggravate uncertainty in expectations and in relationships. When you go from medicine to surgery to pediatrics, there's a different culture, there's a different set of expectations, there's often a different set of rule. This aggravates the problem of cognitive load by adding uncertainty in relationships. And things like this are present in law school, they're present in nursing school, they're present in PhD programs as the candidate moves towards progressively more independence. So the typical curriculum can aggravate this question of uncertainty, and so the problem of the supportive learning climate, of putting the learner in a situation where they can readily address and identify and fix their limitations, is critical, whatever the profession is. Now, let's talk about the timing of learning climate statements. First of all, establishing the learning climate through an explicit statement when you first work with your team is sometimes very helpful. Gee, I've been an intern myself and I know what it's like. I hope my guidance and feedback will help you. But then you have to do this in an ongoing way. It's a week or two later, and now the intern is making a new kind of mistake. And then you say, you know, as I mentioned last week, I want to give you feedback to help you avoid common mistakes. So the learning climate is not just established at the beginning of a rotation, but all the way through the program. Let's now review the key components and specific behaviors of the learning climate category. Stimulation, learner involvement, respect and comfort, and admission of limitations. First, let's talk about stimulation. Showing enthusiasm for the topic and the learner, showing interest through your body language, using an animated voice, providing a conducive physical environment where people can talk comfortably. We're not in a hall with other people shouting all the way behind us. These are some of the behaviors, some of the concrete things that teachers do in order to make the learning climate supportive. I'm going to use some terms that come from educational psychology about inference. A low inference behavior is when there's low guesswork and it's easy to agree on. It's descriptive of what the teacher does. Using learners' names, you call the intern or the student by their name. You look at the learner when they're speaking to you. These are very, very concrete items. They don't require a lot of guesswork. Use an example from feedback. You know, your presentation was excellent. It had all the key points, but it wasn't too long. This kind of low guesswork, low inference kind of behavior and being explicit is very important to beginners, especially when they're dealing with a lot of complex material. Now, a high inference behavior is we might have a situation in which the learner has to infer or attribute ideas or emotion to you. The inference, a high inference, is, oh, this teacher cares about me. I think that the teacher liked my presentation. These things are very, very important, but they're higher inference, they're more guesswork. And a lot of what we say when we talk about teaching behaviors over these seven categories in the Stanford program, we'll be focusing as much as possible on low inference behaviors where it's very concrete, physical, what the teacher is doing. As learners move from reporter to interpreter to manager, expectations increase. And it's sometimes said, excuse me, in medicine, that you're always a beginner. There's always something new to learn. This is true whether you're a resident, a fellow, or even an attending. So this need for the supportive environment, because the intelligent, motivated person is going to feel ill at ease when they don't know something, is persistent throughout our training. I think it's very important when we're dealing with beginners to be explicit, especially in those who are struggling. Somebody may not be a beginner but maybe continue to be struggling. So I emphasize being explicit, using names, being concrete, looking at them, and saying exactly what you mean. The next component of the learning climate set of behaviors is learner involvement. Looking at the learners when you're talking to them or they're talking to you, as opposed to at the computer or something else. Listening to them, encouraging learners to participate. I'd like to hear what you have to say. Avoid monopolizing the discussion. So those are the behaviors having to do with involvement. The next category is respect and comfort. Using learners' names. And if you have trouble remembering names, indicate that to them. Mention it again. Gee, I'm sorry I forgot your name. Please tell me again. It'll be okay, but learning to use names is a sign of respect. Acknowledging the learner's situation or their problems. Gee, I think you've been up all night. It's okay to use your notes when you're presenting today. Inviting learners to express their opinions. Stating respect for divergent opinions. If somebody says something, an intern or a resident, that you didn't quite expect, there's a kernel of truth in it. Explicitly say, yeah, that's very interesting, that's possible. Minimizing interruption when somebody's presenting a case or when they're in the middle of their own discussion. Try not to interrupt with questions if you can avoid it. Sometimes, of course, we do need to change the agenda. Sometimes a student's presentation is too long and you do need to interrupt. So they can't totally be eliminated. Your interruptions can't be eliminated, but they can be minimized. And finally, avoiding ridicule and intimidation. When I was a medical student, I very often said stupid things, and I remember my attendings laughing at me and created a terrible, terrible feeling. As an attending, when we laugh, it's the absurdity of the thing. We don't mean to belittle the student or the intern, but in fact, that sometimes comes across as ridicule. And finally, intimidation. The attempt to motivate the student by saying you're not going to graduate if you keep making mistakes like that. There's probably no evidence that that helps students learn more, and in fact it may move the level of stimulation too far into intimidation. Let's deal for a second with the subject of psychological size, and this is one of the topics on which we'll have readings available. The student is very small psychological size compared to an intern who's a year or two ahead, and of course the resident a year or two beyond that, and we as the attending physician may appear like the planet Jupiter to a beginner or an intern. Why is psychological size important? That sometimes it helps. Sometimes when we need to take charge and be directive and change the subject of the conversation, the fact that we're the attending physician of record, we have size, helps. But at other times it can interfere with the students being able to identify and address their limitations. If the psychological size seems intimidating to them, and we ask a question, now what's not clear here? What would you like me to go over? The psychological size may actually discourage the learner from identifying their limitations. So this is just something to be aware of. The final component of the learning climate category is going to be admitting limitations. This is when you admit your own errors or limitations as an attending. Gee, when I was a student, my case presentations were often longer than needed, and I often had to be interrupted. Avoid being dogmatic, which implies that you don't have limitations, that you know everything there is to know. Acknowledging the learner's limitations. Gee, I realize that as a medical student, you probably have never seen a patient with heart failure like this before. You've only read about it in a textbook or seen a simulated patient, so this is going to be new for you. Inviting learners to bring up their problems. Clear, say what in the situation was in the way for you? What can I do to help that? Acknowledging the limitations in the content of medicine. What I mean by this is sometimes we don't have an answer. We don't know what to do. Diagnostic certainty is not there, or therapeutic certainty is not there. Stating that explicitly sometimes helps the student or the resident understand that we don't expect them to have the single right answer. Finally, acknowledging the limitations in the context of medical education. The student may have last examined the heart of a patient or listened to murmurs in detail a year or so before, and now we expect them to listen to this patient today with aortic stenosis. This is something about the process and how we teach it that is a limitation. These four different components, stimulation, involvement, respect, and admitting limitations, help us to decide how much stimulation is needed to achieve learning. And we sometimes use the analogy here with the Frank-Starling curve of congestive heart failure, in which if there's not enough blood or too much blood in the ventricle, the heart doesn't pump adequately. And this can be true in the educational process, and this has been known for years in educational psychology, that if the learner is asleep, if they're not stimulated, no learning is taking place. On the other hand, if it's terrifying, the learning may not take place either. So this is just something to be aware of when you're thinking about learning climate. Let's try to conclude by relating learning climate to the other categories that we have. Learning climate allows agenda shifts that we sometimes make when we have to conduct the session differently to be less jarring. If we have to say to the student, case is going on a little bit too long, I think we'll have the intern present the findings from here on. If there's trust and the learning climate has been supportive, those agenda shifts are less jarring. Learning climate is always strengthened by having clear goals and expectations for each learner. They know what is expected of them. And when teaching is clear, when the point has been made as clearly as possible, then when you say, well, what if we did this, and you ask them to apply what you just said, if let's say the patient, let's say their temperature was higher than it is now, what would you do? If you've been clear in your teaching to this point, they're better able to respond to that and feel less insecure. Learning climate makes observation, when we have to evaluate learners, much more comfortable. Of course, we do have to evaluate them, we do have to observe them. If there's trust in the situation and the learning climate is strong, it works better. We have to give feedback. Feedback can be stressful, since for anyone, especially for beginners, there's always going to be a lot of corrective feedback. A strong learning climate makes feedback less stressful. And finally, when we admit our own limitations, we can model self-directed learning. A few summary points. There's a lot to learn and a lot to master. The cognitive load is enormous. The emotional climate should support growing expertise and encourage acceptance of responsibility. We don't want the relationship to the attending emotional load to make the cognitive load more difficult. Low inference behaviors, being explicit, establish an effective learning climate. Looking at people, using their names, inviting them to express opinion, these very simple, concrete tasks create a supportive learning environment and more trust. And essentially, trust in leadership, trust in the teacher and the faculty makes everything else work better. Thanks very much. That's the end of our introductory mini lecture on learning climate.